I'm Josephine Kaoma Chimpinde, a student at Texas American University, and my presentation is on criteria for admission to the intensive care unit. And my introduction is that the intensive care unit is a hospital facility for provision of intensive nursing and medical care of critically ill patients. And this is characterized by the high quality of continuous nursing and medical supervision, and by the use of sophisticated monitoring and resuscitative equipment. This is a unit sometimes called intensive therapy unit or intensive treatment unit or critical care unit. Intensive care has been defined as a service for potentially recoverable conditions that can benefit from more detailed observations and invasive treatment that can be safely provided for in general wards or the high dependency units. Nursing and medical care may be organized for the care of specific group of patients, for example, neonate or newborn ICU, neurological ICU, pulmonary ICU. Criteria for admission to the intensive care unit is a tool used to admit critically ill patients to the unit. It is a tool that helps triage patients who should be admitted to the intensive care unit. The aim of the study was to evaluate the use of criteria for admission in the clinical practice for screening of patients for admission to the intensive care unit. Problems identified. The significance of the study was to identify problems associated with the usage of the criteria for admission to the unit. The study has revealed that 20% of the total admission in a month do not fall under the criteria for admission. These are patients admitted for administrative and/or social reasons, unrecoverable conditions such as irreversible brain damage, irreversible multi-system failure. The study also revealed that critically ill patients were usually seen by junior doctors at first instance and made decisions to admit to ICU. Methods used. Information was collected through interview and literature review. Literature review describes criteria for admission as a tool that has remained poorly defined. Identification of patients who can benefit from ICU care is extremely difficult. Demand for ICU services exceeds supply, and rationing of ICU beds is common. Defined criteria of admission is a major challenge that has impeded progress of development ICU standards. Africa faces substantial challenges, including the disease burden. What should be done? The decision to admit a patient to an intensive care unit should be based on the concept of potential benefit. The patients who are too well to benefit, or those with no hope of recovery to an acceptable quality of life, should not be admitted to ICU. Age by itself should not be a barrier to admission to ICU, but doctors should recognize that an increase in age is associated with diminishing chance of serious coexisting disease. Prioritization model should also be applied. Conclusion. An intensive care unit is a unit characterized by the high quality of continuous nursing and medical supervision, and by use of sophisticated monitoring and resuscitative devices. Intensive care unit is a service for patients with potentially recoverable conditions who can benefit from more detailed observations and invasive treatment. The decision to admit a patient to an intensive care unit should be based on the concept of potential benefit. Thank you. I end my presentation.